Hello, I'm Dr. Mugdha Rao.
I am Dr. Mohan Rao.
We are practicing obstetricians and gynecologists and clinical reproductive immunologists. We treat patients with unexplained repeated miscarriages, unexplained IVF failures, and unexplained infertility with the help of clinical reproductive immunology, that is, lymphocyte immunization therapy or IMMU-LIT, and other individualized passive immunomodulatory protocols. We have centers in Mumbai, Nagpur, Pune, Delhi, Bangalore, and Hyderabad. Since we see a lot of patients with reproductive failures and the emotional challenges which they are undergoing, we decided to come up with a unique series called Coping with Infertility or Reproductive Failures. And for this, we decided to take the help of a specialist in this field, a renowned psychiatrist, Dr. Akshata Bhatt. Welcome,
Hi,
Dr. Akshata Bhatt.
hello, namaste.
Welcome, Dr. Akshita.
So, Dr. Akshata Bhatt is a consultant psychiatrist with her own practice at Villeparle East. She has extensive work experience in both public and private sector. After completing her MD in psychiatry from Nasik, she worked for 1 year as a registrar in KEM Hospital, Mumbai. In the past, she has worked with a de-addiction clinic in South Mumbai, managing and treating patients with substance use disorders. She has also been associated with various hospitals and clinics in Mahim and Dadar. She has also worked closely with schools in Villeparle to improve awareness about mental health. She has done parenting workshops as well as stress and anger management sessions for faculty and parents of school students. She is also the consultant psychiatrist at a child guidance center in Villeparle, dealing with academic, behavioral, and emotional problems faced by children and adolescents. She has carried out regular workshops in anger and stress management, work life balance, study skills, and mental health awareness. She has written numerous articles on mental health disorders, and uses social media to promote mental health. She is well versed in handling cases of depression, mood disorders, schizophrenia, dementia, and substance use. She is passionate and enthusiastic about her line of work and hopes that mental health will be given the attention that it deserves.
So, we have an accomplished doctor here with us, specializing in the field of psychiatry. And today we will see how psychiatric help is an important part of fertility treatment. Because we very often, as Dr. Mugdha said, very often see patients with infertility or reproductive failures who have lot of emotional problems. And we realize that when we treat the medical part, still the couple has not come back to normal, or sometimes the results are not up to the mark. And then we realize that yes, this psychiatric or mental component plays an important part in their recovery. So I think we will start today's session, Dr. Akshata, with the first question that usually comes to our mind, that can you explain how infertility, or for that matter reproductive failures, typically affect mental health both in short term as well as in long term?
So, hi, and thank you for having me on this session. So, this is a very relevant question asking about how infertility or reproductive failure will affect the mental health. So, as we have seen that by the time the couple comes for treatment for infertility, usually it may be a few months or a few years into it. So that here you have a couple who has been trying to conceive a few years or into marriage, and they've not been successful so far. So obviously there is a lot of frustration, there may be anger, there's a lot of sadness. They may feel guilty about it. They may also feel that a little feel inferior compared to other couples who got married around the same time, but and now have one or two kids, And of course, the role of society is also is there, because you'll always have people asking that, when are you going to have your first kid and everything like that. So in the short and the long term, it can lead to depression, it can lead to anxiety, it can lead to social withdrawal, because constantly going somewhere and having people ask you what is the status of your child bearing can be so frustrating for people that they would start avoiding social situations altogether. They may experience a lot of anxiety when talking to people, because the worry is there. What if they ask me about this now? What if they ask me about this now? Or there may be general anger and frustration towards people who are asking these questions, or towards people who have successfully conceived, feeling jealous, feeling angry that how come they are doing this, but we are not able to do it, Feeling left out of everything, feeling like I'm being deprived of something so natural, something that is so common that everybody seems to be doing it, but I'm not able to do it.
Absolutely right. I think we also see very often. There was one couple who had come history of infertility, Maharashtrian couple. So this Ganpati season, we asked them, okay, now Ganpatis are there. You must be going to your village, because in Konkan, Ganpati is is a celebrated festival. He said, Doctor, काय सांगू? The last 5 years we have not gone to our village, because whenever we go there, someone asks us. So आता गुड न्यूज कधी मिळणार, or are you taking treatment? So these sorts of questions, they upset the couple. So he said, we haven't gone, and I don't think till this is done, we can't show our face. That's what his word. We can't show our face to our villagers, and therefore we don't go. So I think that is really sad, isn't it?
Yeah, and unsolicited advice will always be there. Na? People will be telling you, do this, do that. Tumi, hey, puja kara, ikade tumi daan dya, do this. A lot of things, not just religious, but even other things, So unsolicited advice is also a reason why people would want to avoid, ki, theek hai, I don't want to hear another person telling me what I'm doing wrong in my life, that why this is not happening for me. And the fact remains that it is a biological issue, but people do not see it as that. And when they come to doctors like you, they really understand the mechanics of reproduction, the science behind it. And that is when, for a lot of people, the eyes actually open and they understand that this is not a personal problem. It is a biological problem. It's not a failing on the part of the person. It's a biological issue which needs treatment, And that is where, your role as consultants is very important, because when you talk to them and explain that how the process actually happens, you'll actually see people getting that spark of understanding that, oh, this is what really reproduction is,
So, I had a couple who, I think they were conceiving and miscarrying. So that wife said, now I feel like a failure. And I feel I will never be successful in any venture of my life. So it gets so much of a center stage of attraction ki other things which are important are left in the background. So I just have this one second question is, what are this emotion? What are the most common emotions which the individuals and the couples, they experience during this struggle of their journey?
So a lot of sadness is part of the process, because they are not able to conceive. So they are very sad about it. There may be guilt on part of the either of the partners. For example, typically it has always been a thing that the couple is not being able to conceive because it's the woman's fault. It's a very common thing, especially in patriarchal societies. It's a very common allegation. But the other part of it is also where the man is seen as not manly enough. He cannot even impregnate his own wife. So this man is not manly enough. So gender roles also come into the picture here. The woman being the sustainer, the creator of life, and the husband being the manly one, the one, who created the life and everything. So here again, gender roles come into the picture, and there's a conflict, because a lot of people are brought up with that notion that this is what you have to do at a certain age. You get married, have kids. This is what you are supposed to do. This is what your life is supposed to be like. So for them, feeling that I'm not fitting in with what is conventionally expected of me, what is traditionally expected of me. I'm not fitting in anywhere. So there can be a lot of anger and resentment, like I said before, towards even their own family members, that why are you putting this pressure on me, towards each other, that this is not happening. Deep down inside, they may feel though it is not biological, the reasoning is not biological, they may feel that the other person is at fault or that the other person doesn't want this baby, something like that. And of course, the families and everybody else is there to add mirch masala to the equation by saying things by तुम्ही असं केलं असतं तर आतापर्यंत बाळ झालं असतं, and all those kind of things. So also there can be jealousy towards other couples, like I mentioned. Typically, if you're of the same age group, common tendency is we always compare with our peers. We'll always compare with somebody within the same age group. So seeing someone who's been married around the same time or for the same number of years of your age group, you may tend to think, Arey, by now they have 2 kids. I don't even have one. So jealousy among the peers, anger, resentment. There can be a feeling of guilt. There can be frustration. Also, with repeated miscarriages, grief is one thing that we need to acknowledge, because everyone perceives a miscarriage in a different way. So the concept of grief, for some, it can actually be that I have lost my child. It may not just be that it was a conception that was lost. I have lost my baby. So it depends on how they perceive it. So grief is also a very, very powerful thing that happens with miscarriages. Also, grief at the repeated failure for IVF, that they are not able to conceive even after this. So all the stages of grief, they can go through that at that time.
Absolutely true. The one more thing that we notice very often is the couples when they're sitting in front of us telling their history, the element of depression or sadness is obvious. Means you can make out that they are not communicating well. So sometimes means they don't have confidence in themselves. So we always feel that. So do you think, how does the experience of this infertility or reproductive failure problems affects that person's sense of self-worth or self-identity? Does it impact adversely because of these fertility problems?
So, as I said before, that men are perceived to be manly. They are supposed to take care of the family. They're supposed to they're supposed to help the woman conceive and everything. So, for a lot of men, if they are not able to, have kids, they may be seen as less than manly. And sadly, since we live in a patriarchal society, this kind of mindset is there, that this person is not even man enough to have impregnate his wife, this kind of concept. So he may feel that people are laughing at me or I'm being ridiculed, that I'm not manly enough. And that, for a lot of people, gender is a big part of their own identity. So I identify as a girl or I identify as a boy. Even at 3 or 4 years old, when you ask small children, they can tell you what their gender is. So for a lot of people, gender is a big part of your identity. And since we are put into specific gender roles, the husband is the provider and the wife is the one who takes care of the house and everything. So when those roles are again being interfered with, that they're not able to have children, so it will affect their sense of identity. A lot of people, especially I've seen with a lot of women, they've grown up being told that you would make a great mother, for example. It's considered a compliment. I think it's a wonderful thing to tell somebody that you'll make a great parent. But having that feeling and not being able to have a child is extremely painful. And especially if you've had that feeling growing up in a big family or growing up in a close family where everyone was caring and supportive. So for people who've grown up in good environments, they will also want to have children because they want to pass on that thing. For example, I have met couples who grew up in very dysfunctional families where the parents were constantly at loggerheads, or they were divorced or separated. And they will say very clearly, or there was an addiction issue. They will say very clearly, to have children because I don't want them to go through what I went through when I was a child, which is very understandable. But here I'm talking about people who grew up in happy, secure environments who say that even I want a big family, like how I did when I was younger, and I was so happy. I had cousins, I had siblings, I had so many people around me. So for someone who's grown up with that idea, when you come to an age and realize that I'm not able to produce a child, it is a very, very painful thing because it is one of your dreams that is being shattered in the process. The dream of having a family, the dream of having kids.
And sometimes we see that that the patient is coming with maybe her mother or maybe sister, but husband doesn't come for even fertility treatment.
Yeah.
And when asking more, then we realize that one of the reports of husband reports are not good or there are no sperms. So he sorts of, it's withdrawn, means he doesn't come. So she says, no, he's not interested. whatever is required, we only have to do. So do you think means the men and women they have this emotional impact is different for a man and or a woman when they are facing this fertility problem?
Because one more thing, what we experience is that, or sometimes when the husband comes, he said that I have to be strong to support her because she gets very upset with every episode of, say, IVF failure or miscarriages. So actually, uh, we understand that he's also going through it, but he said I have to be strong for her. So what, like, can he be really strong, or he's also going through some trauma himself, which he's not bringing it out?
So both these
So
extremes we
here
need to
it's
do.
important to acknowledge that both of them are going through something. It's not just one person. Now, here again, the focus may go on women, generations blaming women for everything. Now, the supportive element is more towards women than towards men because they feel that they are the more vulnerable section, which may be very much true in a lot of cases. Okay. But I'll just point out that everyone has their own journey in this. And for both, I think for the couple, it is both of them will require that kind of care, that kind of support, that kind of understanding that yes, it's hard for both of them. And in any relationship, whether it is a spouse, whether it is a friend, whether it is a parent and child, having one person bear the burden makes it very, very imbalanced. This is going to affect the relationship at some point. So in any situation, you cannot have one person only doing all the heavy lifting. Okay. It's a very basic tenet of a healthy relationship. One person cannot do all the heavy lifting. And in this case also, I think it's important to give the men space to talk about how they feel, that how are they responding to all of this, because I'll give this as an example with when there is a newborn in the house, everybody's focus is on the baby. Nobody asks about the mother. And the constant thing I keep telling people is please check on the mother. Everybody in the house is obsessed with the new baby. So everyone's asking, khaya kya, piya kya, susu kiya kya? But nobody's asking, has the mother eaten? Has she slept? Has she had a chance to take a bath? So this is the same way here. Everybody requires attention. We cannot differentiate and say this is more for them or less for them, or we should be paying more attention here. Everyone requires space to be taken care of, to be understood, and this follow through should happen irrespective of gender.
So I think you said it rightly that both the partners are emotionally affected, and maybe one may be stronger, or maybe he appears to be stronger to support the other. But yes, both of them are equally affected because of this problem. So when they are facing this emotional problem, how can they navigate the differences in their emotional responses are maybe different. So how can they navigate, or rather take care of these responses? Maybe what you can say?
Means how do they take care of themselves emotionally to navigate that journey? Because it's a journey. It's not just a single time process. So it's a journey which they have to, and they have to navigate it skillfully to reach the other end maybe. So how can they navigate that journey then?
So as you both said, it's a marathon. It's not a sprint. It's not a short race. I think that's what everyone is trying to say. And it's a long drawn out process. I think I have seen this with some of my own friends as well, where they tell you that it's multiple IVF cycles and, it takes such a toll on you emotionally. What Sir said before about how the husband sees the wife going through multiple miscarriages or IVF cycles and says that, I have to be the strong one. Exactly. So, like I said, here it should be a situation that, yes, you can be the strong one for her, but then somebody has to be the strong one for you. You have to have someone to hold space for you. And a lot of times it may not be possible that the family can play this role because everyone is going through their own emotions. And I would not want to put that pressure on any one person. Like I said, in any relationship, when one person is doing all the heavy lifting, it becomes very, very stressful. It is going to impact the relationship. If not now, it will in the future. So this is where I would say asking a professional to step in would be a great idea. For example, talking about the reproductive or the biological aspects with either of you, getting a lot of concepts cleared over there, that would be very helpful. Talking to a mental health expert like me, to get the emotional support, good idea. This is the place where everyone has to work together to move forward, and this kind of support, like I would not expect too much from family members or from the spouses for each other, because they themselves are struggling. That's the only reason. They may be very strong and very, very resilient, but like I said, I would not want to put this kind of pressure on either of them. I would say that try to cope yourself and get professional help. That is the best way to go ahead in this situation.
I think that stigma of seeking professional help also needs to be taken out. It's okay. It's okay to take professional help for a disorder which you are facing. There's nothing wrong about it. It's like having fever, you're going to go to a doctor. So it's like that when you're navigating a journey, you need to take professional help from the right person, the psychiatrist. So I think that is extremely important. Now, when you said seeking help from family members, okay, there is one very important aspect which I would like to ask you. It's not only family members, it's the extended family also. So, is there this? Can you talk something about the family issues which come with associated with infertility?
Or the role of family, you can
Role
say.
of family, where it should be, because it's a very, very important. I mean,
one example means the wife patient comes with mother-in-law. She says, इसके सब टेस्ट करो, investigations करो. So when we tell about husband's reports, she says नहीं उनका देखा जाएगा, उसका मेरे बेटे का सब अच्छा है, उसकी जरूरत नहीं है करने की. And then the poor patient goes through this grind again and again, and finally you realize that husband had a problem and because of which they were not conceiving. So this type of interferences from the family, I think,
you must be seeing a lot and you must be having a solution to it.
So the problem with Indian families is that there is no concept of boundaries. I think socially we've all experienced this at some point. Simplest example, going somewhere and somebody talking about how thin, fat, fair, dark, anything about your physical appearance. Somebody just saying it on the face. अगर कितनी जाड़ झालिया है, for example, saying this to somebody when you've gone for a wedding or you've gone for Ganpati or something like that, and the first thing someone says to you, अगर कितनी जाड़ झाली है. So I'm just saying there's no concept of boundaries, which is why we have to start creating them as people. You have to start responding when someone says something like this to you in an appropriate way. I'm not saying go and fight with everybody whenever they say something nasty to you. I'm saying assert your position and tell them that it's not fine for you to comment on my appearance, If you can ignore it, then that's amazing. Like that generally doesn't happen unless we are, very elevated Sant Mahadev people. We can't do that. But factually, we have to learn how to respond so that the person does not repeat this behavior again with you or with somebody else. Now, as far as infertility is concerned, it is everybody's topic of interest. I mean, I have seen this in front of me when we've gone for marriages or functions where couples who've been married a few months are asked जोर जोर से, not even like खोपचे में लेके बात करो, जोर जोर से they will ask in front of everybody, good news कब मिल रहा है, when are you giving us good news? And the poor couple, I mean, बेचारे सज धज के आए थे शादी के लिए, पूजा के लिए, and here they're being attacked, that when are you having a kid? Doesn't stop there. You have your first kid, when are you having your second kid? It's generally like that. So what I'm trying to say here is the role of families is quite important. Their role being stay out of this. This is a couple's matter. It's not a family matter. Stop treating it like a family matter. It's between two people who are trying to have a baby. Unless you are going to contribute in a supportive way, there should be no role for the family member here except to stay out of it. Constantly asking them, what is your progress? What are the reports? What is the help? Should I talk to the doctor? Me doctor la phone karu. And then Dr. Raut will get a call at 3 in the morning from one of the parents of the couple saying that, this is what has happened. I don't know what is going on. And they're still not having a kid. What is going on? So I'm just saying boundaries need to be in place, because with families, Indian families, this is a big issue. They think everything is their business. And the next line will be, but I'm asking because I'm concerned for you. हमको चिंता होती है इसलिए हम पूछ रहे हैं. So what I'm trying to say in a nutshell is that when it would be great if you tell the families in advance that let this be between the couple. Don't get involved in it. Let both of them be a part of it. But unless you're being supportive, please don't get into this because it gets so stressful for them as it is. what we discussed so far, the emotional toll, the psychological toll, the mental toll of not being able to conceive. Uske upar 10 people asking them daily, kuch hua kya hua, what happened? Now, one of the most disturbing things I have seen in practice is where family members were actually advising the couple on which sexual position to take to conceive. And I felt this was a huge violation because this was not coming from, I would say, even siblings and cousins is understandable. Probably there's a tendency to discuss with the same age group. This was coming from the parents of the couple, that these are the positions you should use. I remember when I heard that, I was quite disturbed because it's such a huge violation of boundaries in my head. In another case, a patient of mine, she was telling me about how after they consummated the relationship for the first time after marriage, the husband went and told his parents all the details, like everything step by step. And she was horrified. She said, how do I go and face him after that? How do I go and face them after that? They know everything that has happened. And this is such a huge violation because you're talking about something without taking the other person's permission. I'm going to leave aside the part that this is about sex, which is a very difficult topic for a lot of people. Wo sab I'm keeping on the side. You didn't even take the consent of the person to talk to a third party about all of this. So I'm just saying we are living in a society where these kind of things happen. So it is very important for us to start telling people that it's not okay for you to ask these questions. It's not okay for you to pass these kind of comments on my appearance or about anything else to do with me. So we need to start telling people that. And a simple way to start is by telling the family that let the couple deal with this on their own. Let this be between them. Don't ask them kya hua, kab ho raha hai, kitna hua, ye hua, wo hua. Don't ask them all those questions. Give them, respect their privacy. That is a very, very important concept over here.
I think this must be happening very often because we interact with the couple, we tell the medical part. Sometimes we don't go into the depths of this emotional or the psychological part, and then they really require help of an expert. Because sometimes we see with the couple there are 10 family members who have come, infertility patient, and then each one is telling his own opinion. So I think this is where the things will go wrong, as you said, the family interference into matters which are maybe too private.
Very, very personal.
Very personal,
very
private.
personal.
There was also one more case where they brought a priest or one of the people who looks into holy texts and tells them which are the auspicious dates on which they should try the date and the timing, to look through that. So again, that is, irrespective of belief, I feel it's a huge violation, for somebody to be told that this is what you should do at this time, at this. I feel it's a huge violation when it's unsolicited advice. So we have to move ahead of all of these things and start educating people. What we can do is help by giving proper information. There's a lot of misinformation about everything. So as doctors, what our responsibility would be to quell the notions and give them the correct information in this place.
Because I think this type of interference will affect them mentally, yes, and that will translate into actually physical problems, maybe inability to have relations and all. So I think this stress just is not affecting their psyche, but I think it's affecting the biological function also. So I think this also they should understand, and that's why I think role of a good psychiatrist like you is there in these cases, and it should be made clear by us, I think, with the patient that yes, you have a medical problem we are taking care of, but this is additionally what you should take care of, right? What do you think?
So I wanted to, this brings me to the next question. Now I was thinking, whenever we tell a patient that a couple, that you take help from a qualified psychiatrist so that you'll be able to handle the situation better. So usually it says, no, my mom will do it, or my so-and-so, someone from the family will do it. So do you still feel that there is a stigma around taking opinion from a consultant psychiatrist who's actually qualified to do the job, not a parent or a family member who's going to do it?
So there is some amount of stigma still there about seeking help for mental health issues. It's a lot better than what it was before. Like one of the amazing things I've seen about the current generation in the age group of say 20 to 50 is they are more aware, they are more likely to come by themselves. Nobody has to bring them and take them to the doctor. They come by themselves. They read up about it. They're internet savvy. So they will go online. They will Google their symptoms, which is not always a good thing. But in some cases, yes, it raises awareness. For example, I had a patient who was on a low dose antipsychotic and she developed hyperprolactinemia and she developed nipple discharge. And she was very embarrassed. She's a young girl. She was very embarrassed and she did not know how to tell her mother also. She was so embarrassed. She looked it up online and then she realized that because of this medication, it is a possible side effect, which is when she let me know that, this is what has happened. And we discontinued it. Everything went back to normal. But this was a case where, Googling your symptoms turned out to be a good thing because she was so afraid that what is going on, and the fact that she got a solution and she was able to ask me about it, that was great. So here, I mean, there is a lot more awareness than it was before, but yes, we still occasionally do hear the मला काय वेड लागलंय का और मैं तो पागल हूँ क्या कि मैं साइकेट्रिस्ट के पास जाऊँ. We do hear that once in a while. It's not completely gone out of the picture. It's a lot better than what it was before. And I think one of the reasons, for the stigma is people just assume that it's a willpower issue, like getting over depression, getting over anxiety. नहीं, इसको तो कोई willpower नहीं है ना, इसलिए वो ऐसा करता है. I've heard this statement so many times. And for us, we treat it like a biological issue. Like the parallel I can draw here between mental illness and infertility is that there is a lot of stigma, there's a lot of misinformation, there's a lot of quacks giving a lot of rubbish answers about it. But at the end, it's a biological problem, which requires a biological solution in terms of medication and other things here. So stigma wise, yes, it is getting better. I think even regarding infertility, people are more vocal about it. They're more likely to come and ask you for a reference and, see that can you recommend somebody, which people would probably hesitate before also. But yes, it's there. It's less than before, but it's something that we can all work on.
So I would like to ask you, in your experience, have you seen where, because stress does affect fertility a lot, even the growth of the pregnancy can be affected because of stress. So do you feel if we treat the stress, a lot of infertility issues, a lot of pregnancy complications can be avoided in that case?
So basically, whether there is a link between this
stress and
emotional problem and fertility. Means so far we discussed the stress caused by the fertility problem, but other external stresses, other emotional problems, will it affect infertility or does it? How does it affect?
And if you treat it, is it going to help in the treatment?
So I'm going to divert a little bit and talk about PCOS because PCOS is considered a lifestyle illness, but it is also very commonly triggered by stress. Yeah. One of the common consequences of PCOS here is infertility, which is why it is relevant for our discussion since we are talking about stress and infertility. So again, with PCOS, a lot of people who have worked on themselves have seen that it is reversible. In most cases, it is, and they eventually do end up conceiving and everything. Here, I have seen that people who work actively also to reduce the stress, either by being on medication if required for depression, anxiety, or anything else, or by making lifestyle changes like exercising regularly, following a healthy diet which would eliminate, white flour and sugar and a lot of unhealthy things in it. And other things like meditation or deep breathing, which helps to keep your stress level down. So basically, exercise, good sleep, good eating habits, some form of breathing exercises, all of these things, I have seen that with my patients doing very well with PCOS, with the condition eventually being reversed and everything, So lifestyle is a big factor here, So having a healthy lifestyle which has less stress, because I cannot tell you that stress eliminate hoga. That is humanly not possible. You all are doctors. You know what your lifestyle is like. Even when things are good, they are still challenging, So the point I would make here is find a way to neutralize it. We cannot eliminate it completely. Some jobs are stressful. You cannot eliminate the stress 100%, but you have to find a way to counter it, either by exercising, either by doing some yoga or breath work. Breath work is also very, very effective, and there is, hardly any investment in it, in the sense that you can do it sitting, you can do it lying down, you can do it while you're traveling, so it's very easy. So working on those factors to reduce the stress would definitely help. Also, an increase in stress causes hyperprolactinemia.
Yeah.
The raise in prolactin levels is not conducive for conception. So that is the other, what do you say? The other connection that I would make here. So again, with the hormonal imbalance that comes in because of a higher stress level, uh, definitely bringing down the stress levels would help in increasing your chances of conception better.
So now that you told about the effect of stress on the fertility, so can you tell, means this fertility problem causes a lot of emotional and psychological changes. So can you tell certain steps that the couple can take from the beginning itself so that they maintain their emotional balance or mental balance when they are taking this treatment rather than going into that problem and then correcting? What will help them prevent going into this problem?
So what Sir mentioned before about spouses, being very receptive to their wives when they realize that it has been multiple cycles of IVF or multiple miscarriages, so they decide to take a break, for example. So in this, it's an example of holding space for your partner. It's a way of saying that I understand this is taking a toll on your health, and I'm keeping my priority of having a child aside so that you can do better right now, and then together we will move in that direction. So a gesture like this is very important, taking breaks as required. I think one of the best things is having an honest conversation at the beginning about understanding what your chances of conception are. Though I know that is not always very perfect for anyone to tell, but I'm just saying having an idea, because, for example, with certain age groups, you will know better whether what their chances are, or with certain medical conditions, you know where in which direction. I'm talking about the experts, not about the couple. The experts like both the doctors Raut will be able to tell you here that what is the best way for them to attempt conception, depending on the age, depending on the medical conditions that both of them are dealing with. So they will have an idea of what are their chances. Understanding that this is a marathon, it's not a sprint. That is very important. Also, just because XYZ couple conceived in the first cycle of IVF and we have not in the fifth cycle doesn't mean anything. Keeping that comparison out of the picture, having good boundaries with the family, or having a supportive family who will not constantly interfere in everything. Keeping a good interpersonal relationship with the spouse, having things to do outside of this as well. It should not be just limited to bacha chahiye, so this is what we are. The only time we're spending together is when we are figuring out how to have the baby. You should be having quality time where you are talking to each other, you're spending time doing other activities, maybe common interests. Having difficult conversations is a very, very important thing in any relationship. Having that difficult conversation, that what are we going to do if things don't work out? How many times are we going to try? Or at least having some sort of temporary plan in place. Ki ye nahi hua to theek hai, we'll go here, then we'll figure out what to do. And having that consideration for each other that yes, this is going to take a toll on both of us. So being aware. For example, again, a parallel here I would like to draw is PMS is a very common symptom for a lot of women, and that the moodiness and the irritability that they will feel sometimes it can be very, very difficult to deal with. I've had a lot of patients tell me this, which I found very interesting, was if they are aware that they are having PMS, they're able to control their symptoms a little bit better because they know the reason for it. So I'm just saying that when you know the reason for your anger, for your irritability, for your sadness, it helps. You will not take it out randomly on people, hopefully, now that you have a little bit of awareness. So here, understanding that, yes, this is going to be difficult on me, this is going to be difficult on my partner. So both of us are having a tough time. So let's not get irritated too much with each other. And more than anything else, have a good way to resolve conflict. Conflict hone wala hai. Every healthy relationship has conflict. If your relationship doesn't have conflict, there's something very wrong over there. Okay? You cannot spend so much time with a person and not fight with them. I'm not saying huge, massive fights where you hit each other or use bad language. I'm saying arguments. वो normal है, वो हर couple में होता है. And you have to understand that getting into arguments or this is a normal thing. Resolving it is the important part. How you resolve conflict says a lot about you as a person. So here, this is going to be a bone of contention for a long time, the infertility issue. till the baby is actually conceived and born, it's going to stay in the picture for a long time. So you have to understand that lambe race ka ghoda hai, we should know how to resolve conflict in a healthy way.
Right. I think so. As you said, understanding the problem correctly and then keeping realistic expectations or avoiding unrealistic expectation will help not only in keeping the mind sane, but also I think it will help in the treatment per se, and the chances of success will definitely improve. Right. So I think before we conclude, what we would like you is what message you would like to give to the listeners before Dr. Mugdha concludes this session. So what would you like to say to these
The
couples
first
who
thing
are
I
struggling?
would like to say to the families is that please give the couple space and privacy. Let them resolve this on their own. This is an issue between two people. It's not a family issue. And you can show your support in different ways. I'm not saying that you don't have to be connected in any way. Everyone understands that it is out of concern and consideration. But then there is a healthy way to do it, to support them in a healthy way. Give them space, give them privacy. I've had a lot of situations where I've asked people a very simple question: do you have time and privacy in your house, to make an attempt to conceive? And the answer is no. I mean, it's a different reason altogether for the infertility. Ki time nahi hai and privacy nahi hai. So here, for example, if there is a supportive family who understands that, even they require their time on their own, it goes a long way. Constantly hounding both of them, or generally the woman, sadly, कि क्यों नहीं हो रहा है, तेरे में ही कुछ कमी रहेगा, is not going to be helpful. Driving a wedge in the couple, you are not conceiving because of her or you're not conceiving because of him, is not helpful. So try to be supportive, be mindful of your boundaries when you're related to this situation. That is the first thing I'll say to the families, that please be supportive, please be kind, please be mindful of the way you talk to them. Also drop this whole thing of asking people bacha kab aane wala hai. Married couples just like meeting them at a wedding or a puja and asking them when is the good news coming. No, don't ask that. There may be people who may not want to have children at all, and it is their choice.
Yeah.
We have to respect that. It is not up to us to determine what other people should be doing with their lives. Okay. For the couples, I will say that please understand that this is going to be a time consuming affair. It's going to be stressful for both of you. You all are both going to have moments where you are absolutely low and you feel that, things are very difficult. And talking to a health expert, mental health expert, talking to a counselor, maybe even going for marriage counseling together would be helpful. Having a few supportive friends or family is a huge asset. Social support goes a very long way. But if you don't have that, then please take professional support at least. The other advantage of taking professional support is there is no bias over here. When you go to a professional, they are not concerned about who is what. They don't have any affiliation with anybody. They will just do what they think is in your best interest. So, and that's why going for professional support is a good idea. And be kind, be patient, be supportive, and try to do the best that you can for each other. That's what I will say over here.
Oh, great. It was a lot of learning experience for us also, Dr. Akshata, and even for the viewers, I'm sure. So I would tell, stay tuned for all our subsequent sessions. So you will have great insights into how you can handle your mental health in reproductive failures. Thank you. Thank you, Dr. Akshata.